In this video, we will talk about Intracytoplasmic Sperm Injection, ICSI. It is a technique used for in vitro fertilization, IVF. It is the fertilization that takes place outside the body of mother, as you can see in the figure. A needle is being injected into the cytoplasm of the cell. This needle is the micropipette, and it is injecting the sperm into the egg. Now, what is ICSI? In this technique, a single sperm is injected directly into the egg, for the purpose of fertilization. What is procedure of ICSI? First of all, preliminary checkup of husband and wife is done, and baseline hormone levels of wife are taken. Now, the procedure of ICSI will begin. This procedure consists of 11 steps. We will discuss them one by one. Step 1. Stimulation of ovaries. By special medications, the ovaries are stimulated to increase the growth of follicles that contain the eggs. Step 2. Control of follicles. By transvaginal ultrasound and hormone blood tests, we observe the ovaries to see their response to those special medications, to control the size of follicles. Step 3. Egg release. To increase the maturation of egg, to assist in that maturation, and to increase their loosening from their follicular wall. An injection of human chorionic gonadotrophin hormone is given. This injection is called trigger. Step 4. Egg retrieval. After giving this trigger injection, 35 to 38 hours later, the eggs are retrieved from the ovary, while patient is sedated. Step 5. Sperm selection. The sperms are placed in a special media that contains hyaluronan. It binds to the sperm containing most intact DNA. Thus, the embryologist selects those sperms that are bound to hyaluronan. This helps in selection of much mature and motile sperms. Step 6. Egg maturity assessment. The cumulus cells surrounding the egg are removed by a special enzyme, so that we can have a better view to see the egg's maturity levels. Because only genetically matured eggs are useful in ICSI. Step 7. Injection of sperm. It is also known as insemination. An injection containing a single sperm is injected into the cytoplasm of the mature egg. Step number 4, 5 and 7 are done in a single day. Step 8. Fertilization. After insemination, the petri dishes are placed in an incubator for 16 to 18 hours. After which, they are observed for fertilization. Step 9. Growth of embryo. The embryos are grown in lab for next 2 to 5 days. Step 10. Transfer of embryo. The chosen embryo is loaded in the transfer catheter, and is passed through the woman's cervix into the uterus, where it is released. Mostly, only one embryo is released into the uterus. In some special cases, 2 embryos are released. Step 11. Vitrification. Other successfully grown embryos in the lab that are not used in this cycle. They are not destroyed, but are frozen and stored for future use. In cases, if the cycle has failed, or if parents want another child in the future, after embryo transfer, patient should limit her activity for next 24 hours. Patient will wait for 2 weeks, because the next 2 weeks after transfer of embryo is the luteal phase. After luteal phase, patient will undergo a pregnancy test. Indications for ICSI. Firstly, we will discuss the female factors: tubal damage, polycystic ovarian disease, unexplained infertility, endometriosis, maternal age 38 years or older, low oocyte yield, eggs have not fertilized by traditional IVF, in vitro matured eggs are being used, previously frozen eggs are being used. Now, we will discuss the male factors: oligospermia, low sperm count, teratozospermia, abnormal morphology of sperm, astenosospermia, abnormal low motility of sperms, high level of antibodies in semen, sperms retrieved through testicular sperm extraction, retrograde ejaculation of sperms, so sperms don't go into the semen. They go back to bladder instead of going to urethra. So they are found in the urine. Success rate of ICSI is only 30 to 40%, and it is found to more successful in couples in which male factors are a cause of infertility. Major concerns of ICSI: ovarian hyperstimulation syndrome, multiple pregnancies, increased risk for male baby to have same fertility problems as the father, slightly increased risk of birth defects. Price range of ICSI: this is the minimum theoretical value. In Pakistan, it is 250,000 to 350,000 rupees. In India, it is 200,000 to 300,000 rupees. In UK, it is around £2,100 sterling. In USA, it is about $800 to $2,500. Thank you for watching. Stay tuned for more.